My name is Marc Michelson, and I practice ophthalmology in Birmingham, Alabama. My specialization is in cataract and refractive surgery. I've had a Pentacam since 2005. The Pentacam was an instrumental instrument for me when I discovered how useful it would be in detection of early keratoconus, recognizing that the elevation abnormalities that were detected on the Pentacam would be a great, valuable asset to our practice in screening primarily for refractive surgery. We incorporated a Pentacam into our refractive practice for screening purposes, and it became an automatic screening tool to rule out any patients that we thought might be at risk for ectasia with LASIK surgery. I first became interested in the Pentacam when I heard a talk at the Academy in 2004, when the Pentacam was first introduced in this country. And I was fascinated by the expansion and the capabilities that the Pentacam had over conventional topography. And recognizing this and the value that this instrument would have in our refractive practice, I immediately decided to purchase one and learn about it. I must admit, when I first got the Pentacam, it was rather overwhelming because the amount of data that it presented a challenge just understanding exactly how to use it. But over a course of several months and being hands-on on the instrument, I rapidly learned how to utilize the instrument and detect and read the instrument to our advantage for screening purposes and early detection of keratoconus. The Pentacam has vastly improved the quality of care in our practice. Not only do we use it in our refractive practice, but we now employ a second Pentacam in our cataract surgical practice. It's especially useful in patients who are potential candidates for premium IOLs. That's because anybody who's a potential candidate for premium IOL is also a candidate for LASIK or other refractive surgery. Therefore, it's essential that the Pentacam be used on every patient that might be a candidate for a premium lens implant. The Pentacam has been an extremely valuable instrument in IOL calculations, especially in the post-refractive cornea. We have developed our own methodology for utilizing the Pentacam for very accurate IOL calculations in patients who've had either RK, myopic LASIK, or hyperopic LASIK. We use the detailed Holiday EKR report and look at the 2 millimeter optical zone. In patients who are post-myopic refractive surgery, the flat K value in the 2 millimeter optical zone is used in the SRKT formula for both the K1 and the K2 values, and it has proven very accurate without any prior history to accurately calculate and predict lens implants in post-refractive patients. In the hyperopic patients, we use the steep value, the steep K in the 2 millimeter optical zone, and plug it into the same formula, the SRKT, and find that it's extremely accurate in the post-hyperopic patients. I think the Pentacam is a valuable instrument not only for me, but for other surgeons to learn, because it will enhance their understanding of the cornea, enhance their usefulness in using it in their refractive practice as well as their cataract practice. It's especially of interest in patients who have unusual corneas, irregular astigmatism, and detecting early keratoconus and looking at posterior elevation abnormalities. One of the great things about the Pentacam is it not only analyzes elevation data from the front surface of the cornea, but it also calculates elevation data on the posterior surface of the cornea. There's not another instrument that I'm aware of that can do this to the level and sophistication that the Pentacam does. As a consequence, we can look at both the anterior surface and the posterior surface of the cornea, and this becomes especially of interest in patients who might be at risk for ectasia, early keratoconus detection, or any other abnormalities in the cornea. Since I've owned a Pentacam, my experience with Oculus has been great. I've enjoyed the opportunity to be a speaker for Oculus on multiple occasions at both ASCRS and at the AAO. I certainly enjoy teaching other physicians about how I learned how to use the Pentacam and disseminating what I know about the Pentacam and how it becomes useful in my practice. And Oculus has been very good at facilitating me to disseminate the knowledge that I have in teaching other physicians about the use of the Pentacam.